Hi, welcome to the Hatching for Health show. I'm your host, Jessica Hatch. Today's episode, we have a family on. We have husband and wife Ben and Merci and their daughter Sophie. We're going to talk to them about her diagnosis, which is actually unknown as of today. So it is a unique situation where we will not bring on a specialist, but rather we will wait, talk with them, learn their story, and then in the latter months, we'll have them back on the show where we can learn more about what the diagnosis is. But if you are listening and there's anything that you learned from this episode or information you can share, if you know a child or a family that has a similar condition as hers, please feel free to reach out and we'd much appreciate that. So let's get started and bring the family on. Welcome back. Thank you so much for tuning in. We have the family that has just arrived. And thank you guys for being here.
Thank you for having us.
Yeah, so we have Ben, Merci, and their daughter Sophie. How are y'all doing?
Wow, thank you. We appreciate this opportunity.
Yeah, I'm really appreciate you guys being willing to tell your story. I know that y'all have a lot of, unanswered questions yourself, but I think it's important to kind of share what's been going on, really since her birth, and allow us to learn, and maybe there's some feedback, out there that others can even help you guys with. So I like to kind of just start by understanding from, really when she was born, as it sounds like that's when, from the beginning, you realized that, being that she's a twin, that obviously there were some symptoms going on that were not the same as her sister. So kind of tell us a little bit about that when you kind of go back from the time of birth.
Absolutely. Initially, my pregnancy was very difficult, but so it was always a concern, the birth of the babies, if they were going to be healthy. And with Sophia, we noticed almost immediately at birth that something was wrong. They were struggling on the operating table. I was having a C-section, and then when they finally pulled her out, she needed oxygen immediately. One twin they said was okay, the other one was struggling, so we could tell something happened right at birth that we weren't aware of.
Okay, so really right at birth. So was there any kind of genetic testing that was done?
Nothing significant showed up on the test.
Okay.
So it was a shock for us at birth.
So when she first came out, her sister tried to come out first.
Okay.
And the doctor said, no, we got to put her, they kind of pushed her back in and brought her out because she was struggling. So immediately out of the womb, she said hi to us, but they put her on oxygen immediately. And she was in the NICU for
about 18 days.
18 days.
Really? So there was nothing related to her oxygen levels being cut off, like with, whenever both of them were coming out? Like, how sometimes they, I guess when they stay in too long, the oxygen starts to...
Well, they just said that she was more in distress. So they needed to get her out first. So when her sister tried to come out, they're like, we can't let that happen to her. They had to push her back in and pull her out first.
Okay. And her sister during all of this is fine. She comes home with you guys and she's not having any, kind of additional assistance needed in the hospital?
Well, they were both born preemie, 33 weeks and 6 days. So they both needed extensive care. They were on IVs, they were hooked up to different machines. And so we could tell immediately that her sister was just thriving. She was reaching goals and milestones pretty quickly for a baby in the NICU. Yeah. And as she was growing and developing quickly, Sophia was declining and her health seemed to be deteriorating.
They realized that she didn't have a swallow very early on. They weren't sure what was going on. They ran all the tests they could think of, genetics. They did a muscle biopsy. I mean, they've done, when she was in the hospital, they did everything they could think of. Okay,
so at this point, you're, both of them are staying in the hospital, and then how long was it until you were able to bring both daughters home?
Probably after 3 weeks. They were able to let Sophie go home earlier than expected because there was nothing more they could do for her there in the NICU. Okay. They let us know that she didn't, as far as they know, she wasn't born with a swallow. She wasn't born with a swallow. She wasn't born with a suck reflex or gag reflex. Okay. So she was struggling there, but they kind of trained us in what to do, how to feed her through an NG tube with a tube in her nose. And just gave us a quick study on how to do this. It was extremely overwhelming. So we had one baby that was healthy, but still a preemie twin to take care of, a 3.5-year-old, and then a child that we had no idea how to take care of.
Yeah, so as they're growing, I mean, what age was it where you're able to say, okay, let's go to, a doctor and start getting new tests done? I mean, when they started to crawl, or like one was talking, one wasn't?
Actually, it wasn't a progression, it was more of a deterioration, or she took a step back, not deterioration, but she took a step back. She wasn't getting stronger.
Okay.
Her suck, swallow, gag they weren't developing, so she ended up having to get a feeding tube in her tummy. So that's a more permanent solution because children can take out the NG tube. As her hands were moving as a little one, she was pulling out the tube.
Okay.
And so she still has a feeding tube in her tummy to this day.
And she's 8 years old?
She's 8 years old. And so she is able to eat by mouth. She's able to eat all her foods by mouth. And she is able to now drink by mouth, which was even a bigger development, a bigger miracle for us. And so we were told never to give her anything by mouth because that can cause silent aspiration and eventually pneumonia, which could be fatal. So it was a very scary time for us. We couldn't let anything go in orally. And so at 4 months, it was decided that she should get a feeding tube, something more permanent.
Yeah.
And then we had my sister come in who was helping me take care of her, and she helped us so much with feeding that she got her started eating by mouth. So that was a big development for us, but drinking took a couple of years. It took years, and it's only within the last couple of years that we feel safe to give her liquids by mouth, and we keep the tube in for like supplements and vitamins that she might not enjoy, or for extra supplemental to her diet. And we noticed she is getting stronger. Her mouth is able to move the food around a lot better. We just don't see a lot of the chewing action right now, so it's still a little bit difficult.
So tell me about her other senses, like her sight. I mean, does she see? She knows who everybody is, and family, and other people that you guys communicate with. Like what other I guess specialists are you guys looking to consult with that we might be able to help make that connection?
Vision was an extremely difficult area for us to work on. We didn't know how to approach it. We could tell that her eyes were weak.
So when she was a baby, her eyes would focus on one thing, but as she got older, one eye would drift.
Right.
My wife called and she was able to schedule an appointment in like 2 or 3 weeks, and we were able to see an ophthalmologist there. He was an amazing ophthalmologist. He was head of ophthalmology at UCLA. I mean, he did a lot of retina surgeries overseas. So when he met with us, he took his time with Sophie and really went into detail. And he was the first person that ever told us that she had lack of oxygen and could say why.
Yeah, he noticed immediately when he did some tests that her optic nerves were deadened. So we were now hearing that there was some dead nerves in her brain. There was enough damage to see the deadened nerves.
Really?
Yes, and so he was the first person that actually told us that. So we were able to now we had a base. Okay, like we know that there's nerve damage, and he just encouraged us to not do the surgery, but to do more of exercise, eye health.
So he wasn't saying, hey, go ahead and have surgery on this, like fix the nerves, or is he saying it's really not a surgical
He said
option?
The surgery was going to be more for the person looking at her, and not for her to look at the person.
Right. So they would kind of twinge a muscle to make her eye go inward, but that wouldn't do much for her.
Okay.
And eventually she could she could possibly need to have that surgery.
It would be almost more cosmetic.
Exactly.
Versus like, okay, let's, really help her in ways that, are much greater.
And so we decided not to do that. Her eyes did eventually get stronger. We do notice some muscle weakness there. And so we do want to keep up with her eyes, but we know now that she can manage a cell phone pretty well. She can go into her apps. And now when I see all the things that she has learned just by watching us manipulate a cell phone, that's encouraging. Because if she can see a small little app and she can see the skip ad button, then she's doing a lot better than what I thought.
I would agree.
Cognitively and visually.
Okay, that's great. And her taste, does she have, her taste buds, like when she's, eating different things that y'all do feed in a kind of in a softer form? Can you tell when she's more excited about the way that it tastes?
So that was something we were also concerned about as well. She pretty much seemed to eat everything we gave her without telling us no. And maybe it was because she didn't have food orally for such a long time. But
she was just enjoying the
so she was just
the way that it went into the mouth and swallowed. And
so when we introduced juices within the last 2 years, and then we gave her honey and ketchup and things that had like maybe sweeter textures, and we saw how much she enjoyed it. So we were like, okay, now when we're at dinner or breakfast and she sees honey or she sees ketchup, she wants to add that in, or she'll request it now. And so now we're seeing that her taste buds are there. They're doing great.
So I remember when I met you guys, she was in a wheelchair, and then she had gotten out of it, with the help of you guys. So where is she at with that? Is her spine developing in a way? She's, stronger and walking?
So it wasn't an issue with her spine. It was an issue with the global hypotonia. It was like a global muscle weakness through her whole body. And so we're not able to tell exactly what has developed, but we do know that her core strength has developed. We do a lot of core work with her, or different exercises, and also we practice walking with her, and even if it's using motivation, like an iPad in front of her, or say, hey, we're going outside to the pool, and so those are things that automatically she'll want to do, so she's willing to exercise for it. And so we kept doing methods like that to help her practice walking.
One of the big things when we were in Virginia, she would go to a therapy center called Richmond Home Therapy, and they would do these 3-week intensive PT sessions with her, and they would always tell us her core needs to get strong. So I mean, the videos while I'm at work that my wife was sending me, it was just her on bungee cords, her strapped onto like special needs bicycles. Like she was doing very intensive therapies, but most people, when you do something like that, you come home tired and exhausted. She had more energy. She was ready to go.
Really?
I mean,
she would be almost distraught after the 3 weeks were over. She would do 3 hours a day for 3 weeks of intense physical therapy.
And this was somewhere local or outside of
Virginia?
In Virginia, okay. So would you say there's a lot of healthcare like opportunities or options for her that you're, I guess, kind of falling short of because of the insurance coverage not being there?
Absolutely.
Because it sounds like with physical therapy and the dietitian or nutrition side, a lot of these things are going to just be out-of-pocket expenses to, is that right?
Absolutely. She needs occupational therapy, feeding therapy, physical therapy, visual therapy to help get her eyes focused.
So what, right now with with the insurance, like what does it cover that's specific to helping her besides, going to a routine, family practitioner or pediatrician?
What she gets covered is they said she can definitely have PT, OT, and speech therapy. However, you have a limited amount that you get per year. So that's what we're under. So we're like sparingly using these therapies so that we don't run out in May. And we can stretch it out to December.
And do y'all have any other type of people that come and help her at the home, or you guys do all of that?
We do. We found that through this current job that we have right now, through our insurance, they pay for like a home health aide, and so we have somebody coming with her that is able to help her with education, and generally they do whatever she's capable of doing with those. We can qualify for about 4 hours a day, so they come in for those 4 hours and help her get some activities, some educational activities, and then some physical activities. So that's been really helpful for us.
Like, where are you guys at right now with, trying to help her developmental side, everything? Is it going through with occupational therapy, physical therapy, and I guess some of the other where they work with her vision? So she's having these sessions, an X amount per year based on the insurance. And then outside of that,
we've chosen not to do physical therapy or occupational therapy. Because if we were to engage in all 3 areas of help for Sophia, we would run out within 2 months or 3 months. We would have 9 months without therapy. And so for us, we have chosen to use the option of speech therapy and just stick with that and spread that out over the years so that they can. We found a particular therapist that has worked with children with feeding issues. So
Okay.
she's able to give us great advice and suggestions for helping us to feed her. And also she's able to work with her in speech.
So
So
it's
getting
like
her to either use a communication device or getting her to use motivating factors to help her communicate with us, because that's a goal for us. We want her to be able to communicate with us. We realize that as she gets older, it's going to be more and more frustrating if she doesn't get her needs across and if they're not getting met because she's not able to communicate.
I see. So is there anything that she's able to say right now with
She has said mom a numerous
really
amount of time.
not dad?
Not that. That's a whole different type of strength in her tongue. I
Yeah.
believe that she has not tried to exercise. She has said mom because it's just one of those easier sounds where she has to put her lips together.
Okay.
And she says it when she's desperate for me to do something. she'll break out with it.
It's a lot of, good news, and obviously it takes parents like yourself that are patient to make these things happen, because with 2 other children that you're taking care of. So I applaud you guys on everything with her. It's amazing. It's a full-time job with just her, and you want to give attention to the others. Our goal here on Hatching for Health is to create awareness for children that have whether it's a genetic disorder or just a rare condition. I know that I spoke with y'all a number of times about coming on, and obviously with your schedules it's been difficult, but if anything, just sharing her story, and maybe there's things that you guys have done that's helped her, that their child's like, oh, we can maybe look into that, and that be an option that helps us. But I like to do whatever I can to connect you guys. I know I have a dietitian that I work with a lot of the children, and she's has a master's in dietetics, and I'd love to connect her with you and just see. I know she currently works with Cigna, but she independently helps with any of the children that are on the Hatching for Health show. But additionally, is there any doctors that I could potentially align, just kind of on the foundation's I guess dime to help with? You mentioned something yesterday about you're going to be seeing various group of specialists that are going to kind of look into what's going on.
So yes, we're going to be going to a special needs clinic, and she'll be seen by a nutritionist, a neurologist, I believe, and then the director of the special needs clinic.
Okay.
And so we're going to have that team hopefully take a look at her.
Okay.
And give us more information about possibly what she's seeing, or possibly what they're seeing in her, and give us information about maybe a possible diagnosis. When we moved to Virginia for about 1 year and 10 months, she was seen by neurologists there, and she was still about 4 to 5, so they weren't able to tell us as well like what was happening. And so we're thinking, now that a couple years have passed, she's changed. There are some different movements that she has, or there are some things that she might be doing that they can spot right away.
And I asked this, I believe, before, did she ever have an MRI scan as a baby, or what age was that?
She did, and
It's about 1 year old, I think.
about 1 year old. That was at Texas Children's.
Yes.
Okay.
And so she is overdue for one.
Yeah. I would like to, maybe even before this visit she's going to have with the specialist, do an MRI here. That is something that we can, definitely do. Don't worry about the insurance. Just so you guys have that record to, to take with you, and with the next appointment that you would have with a pediatric neurologist. Yeah, and the dietitian I'll definitely connect y'all with as well. Her name is Jennifer, and she's very, very helpful, and she'll kind of talk about all her current eating habits and the nutrients she's getting through the tube, or I feel like it's kind of a story I'd love to follow, and help in these few ways, and then learn more from your own education you're getting, and then just keep connecting with you guys. I know it's time out of your evening to come over here, but I love just sharing your story. From the moment I met you guys at the park, there's some sort of connection there, and I see progress, and it's without I've not done anything, but I'm like, it's beautiful just to kind of see the little steps that she's taking. So thank y'all so much. Is there any questions that you have?
I think for any of the families that are actually going through anything similar, there was one doctor in the beginning of this whole journey that spoke to us, and he was the one doctor that we dreaded to hear from.
He was a developmental doctor.
He was a developmental doctor, and we were
so scared of hearing a negative report because she wasn't developing at that time.
Yeah, and the one thing that me and my wife, we still hold on to is, doctors come in and out for 5 minutes, see a glimpse at your child. As parents, you're going to see everything that they are able to do and not able to do. So don't ever solely go off of what a doctor says, go off of what your child tells you.
I think that's a great point that you're making. I appreciate you saying that because you guys are with them, hours, minutes of every day, and it's such a different, viewpoint that you have compared to them sitting in front of, a doctor for 10 minutes and them kind of trying to give you their best answers. So yeah, I would agree. Thank you for sharing that. Is there anything else, Hugh Mercy, that you want to add? And
I'm just grateful for the opportunity. I hope that either if we hear through families, if they have any questions, we're very open. It did take us some time to get out here, but I'm so glad that we did. Some of these things that we were told that we weren't sure if she would ever eat by mouth. So for her to take that food by mouth and to eat everything by mouth. And that's a perfect example.
You sit in front of a doctor that tells you things that, your child may not do, and then they do it and you're like, okay, well, we just proved them wrong. Let's go on to the next.
That's exactly right. She has jumped over milestones, and her lack of diagnosis has been a blessing in disguise in that she has no limitations. She's not limited by this diagnosis. So if she wants to become a doctor herself, that could be in her future.
That's beautiful. I'm going to have to use that. Because there's a lot of, we've had rare diseases, what we call, come on the show where they're like 1 in a million, and it's like, but they have, now it's like, this is what you have. And, in a way there becomes limitations because they figure everybody who has that same problem, they kind of pigeonhole them. But when you say, no diagnosis means no limitations, I think that's a great slogan for her.
Right.
So
I think one thing that we heard one Sunday, Pastor Joel said, you don't want to speak something over yourself. And her never having a diagnosis has never been, to Mercy's example, never putting a limitation on it, right?
Yeah.
It has worked. We only work with people who believe the same as we do, and that she has no limitations.
And if you feel that your child doesn't understand, she's a perfect example. She can't speak, but if she knows that you're not confident in what you do, she will throw a fuss.
Really?
So she won't work with therapists that do not look confident.
Well, we're going to help however we can in these, little ways. But if it creates any progression, like you said, it's it's another milestone for her. So thank y'all so much.
Thank you. Thank you for having us.
Definitely.
Thank you for everything that you're doing also.
Yes. Definitely.
Yes,
I appreciate it.
Absolutely.
Definitely. Well, thank you so much for everybody for tuning in. We hope that this could help you or someone you might know. And if you have a child in need and there's anything that we can potentially do to create awareness, please feel free to reach out to us and we will do our best to help. Thank you for tuning in. Now, next week's episode is about Krausen syndrome. We have a little girl who will be joining us who just had brain surgery regarding this particular disorder that she has. So she will be on and we'll get to visit with her and learn her story along with her mother. And we are so very excited that they're going to join us. So tune in and we will learn more.